Hey everyone, welcome back to the channel. If you're new here, I'm Azim, and on this channel, we talk about real issues that affect real people, without the BS, without the filters, just honest conversations. Today, we need to talk about something that's impacting nearly 48 million Americans right now in 2025. And chances are it's either affecting you, someone you love, or someone in your community. We're diving deep into the mental health crisis in the USA. And I promise you, some of these statistics are going to shock you. But before we get into it, if mental health awareness matters to you, hit that subscribe button, ring the bell, and let's build a community that actually gives a damn. And hey, if you want to support the channel even more, you can send a super thanks, drop a super chat during our live streams, or join as a member for exclusive content and early access to videos like this. Every bit of support helps us keep this conversation going. All right, let's get into it. So here's where we are in 2025, and I need you to really hear this. 18.3% of American adults are currently experiencing or being treated for depression. Let that sink in. That's not have experienced depression at some point. That's right now. We're talking about 47.8 million people walking around carrying this weight every single day. And it gets more intense. According to brand new research from Johns Hopkins published just a few months ago, nearly 1 in 10 adults, that's 8.9%, reported experiencing a mental health crisis in the past year. We're talking about moments where thoughts, feelings, or behaviors became too much to handle and required immediate help. Here's what's really alarming. This depression rate has more than doubled since 2015, when it was around 10%. And most of that spike, it happened during and after the COVID-19 pandemic. The world changed, and so did our mental health, permanently. But here's where it gets personal, and this is what keeps me up at night. Young adults, people aged 18 to 29, are reporting depression rates of 26.7%. That means more than 1 in 4 young people are struggling right now. And this isn't a small increase, folks. In 2017, that number was 13%. It has literally doubled in 8 years. Think about the 18-year-olds today. They were 10 when the pandemic started. They missed crucial developmental years, proms, graduations, just being kids. They grew up on social media, watching everyone's highlight reels while dealing with climate anxiety, political division, economic uncertainty, and a world that feels like it's falling apart. And it's not just young adults. Among youth aged 12 to 17, 15.4% experienced a major depressive episode in 2024. That's 3.8 million kids. And 10.1% had serious thoughts of suicide. That's 2.5 million children thinking about ending their lives. I don't know about you, but that breaks my heart. These are our kids, our siblings, our students. And the report shows that over 1 in 4 youth didn't even get a preventive health visit in 2022-2023. That's 7 million young people falling through the cracks. Now, there is a small silver lining here. Youth mental health did improve slightly from 2023 to 2024, so there's hope, there is progress, but we're still in crisis mode. Here's something we can't ignore. Mental health crises aren't affecting everyone equally. This is as much a social justice issue as it is a health issue. According to the Johns Hopkins study, Black adults reported mental health crisis rates of 11.8%, compared to 7.4% for white adults. Hispanic adults came in at 10.5%, and people experiencing housing instability, a staggering 37.9% reported a mental health crisis in the past year. And let's talk about money, because it matters. Among people earning under $24,000 a year, depression rates have skyrocketed from 22.1% in 2017 to 35.1% in 2025. That's a 13-point increase in 8 years, with a 9-point jump just since 2023. When you can't afford rent, when you're choosing between groceries and medication, when you're one emergency away from homelessness, yeah, your mental health suffers. This isn't weakness. This is systemic failure. And here's the cruel irony. The people who need help the most are the least likely to get it. 9.2% of adults with mental illness are completely uninsured. That's over 5 million people. And 1 in 4 adults with mental illness reported they couldn't get the treatment they needed. Imagine being in crisis and having nowhere to turn. Imagine knowing help exists, but you can't afford it. That's the reality for millions of Americans right now in 2025. Now, let's talk about something that doesn't get enough attention, but is deeply connected to all of this: loneliness. Gallup just released data showing that 21% of Americans experienced significant loneliness a lot of the day yesterday. That's the highest it's been since March 2021, during the height of pandemic isolation. And among young adults, 18 to 29, 29% are experiencing daily loneliness. Think about that. We're more connected than ever. Social media, video calls, instant messaging, but we're lonelier than we've been in years. And research shows a direct link. 1/3 of people who experienced loneliness the day before were also suffering from depression. The constant social comparison, the curated perfection, the doom scrolling, the replacement of real connection with digital interaction, it's taking a massive toll. We're substituting depth for breadth, quality for quantity, and we're paying the price in anxiety, depression, and isolation. You can be surrounded by people, online and off, and still feel completely alone. And that loneliness, it's killing us just as surely as any physical disease. Okay, so what's being done about all of this? Well, there's good news and bad news. The good news, in late 2024, new mental health parity rules were finalized. These are supposed to require insurance plans to provide equal access to mental health care as they do for physical health care. No more discrimination, no more arbitrary limits. The 988 Suicide and Crisis Lifeline is now nationwide and available 24/7. The bad news, in May 2025, the current administration announced it won't enforce those Biden-era mental health parity regulations that were supposed to strengthen protections. And despite 988 being available, the Johns Hopkins study found that fewer than 1 in 20 people in crisis actually used it. Why? People said they didn't know about it, didn't trust it, or were worried about cost, or felt they could handle it themselves. The most common help people sought were healthcare providers, 53.2%, and family or friends, 39.8%. This tells us something crucial. Formal crisis systems aren't enough. We need to meet people where they are, in their communities, with their doctors, through their personal networks. The infrastructure alone won't save lives if people don't know about it, trust it, or can access it. All right, enough doom and gloom. Let's talk about what's actually working, because there are bright spots. According to the National Academy's report from April 2025, early intervention and prevention-focused care are showing real results. Programs that catch mental health issues before they become crises, especially for youth, are making a difference. Things like school-based mental health services that reach kids where they are, telehealth therapy that breaks down geographic and cost barriers, community mental health clinics that provide sliding scale services, peer support networks where people with lived experience help others, integrated care models that treat mental health alongside physical health. Some states are leading the way. California just expanded mental health access with landmark rulemaking in July 2025. Medicare extended telehealth coverage for behavioral health through September 2025. These aren't perfect solutions, but they're steps in the right direction. And here's something that doesn't cost a dime but makes a huge difference: human connection. Check in on your friends, having real conversations without phones, building community, sharing your own struggles so others know they're not alone. The research is clear. Social connection is protective against depression and anxiety. Real relationships, not Instagram followers, save lives. So, what can you do? Whether you're struggling yourself or want to help someone else, here are concrete action steps. If you're in crisis, call or text 988 for the Suicide and Crisis Lifeline. It's free, confidential, 24/7. Text HELLO to 741741 for the crisis text line. Go to your nearest emergency room. Mental health emergencies are real emergencies. Reach out to someone you trust: family, friend, teacher, coworker. If you're struggling but not an immediate crisis, talk to your primary care doctor. They can provide referrals and often prescribe medication. Check out therapyden.com or openpathcollective.org for affordable therapy. Look into community mental health centers in your area. Many use sliding scale fees. Try free mental health screening at mhascreening.org. If you want to help others, learn the signs of crisis and how to have supportive conversations. Challenge stigma when you fear it. Normalize talking about mental health. Support policies that expand mental health access and funding. Volunteer with organizations like NAMI, the National Alliance on Mental Illness. And just be present. Sometimes listening is the most powerful thing you can do. And look, if you're watching this and thinking, I should reach out to someone, do it. That text you've been meaning to send it. That call you've been putting off, make it. That therapy appointment you've been avoiding, book it. Your mental health matters. Your life matters. You deserve support, and asking for help isn't weakness, it's courage.
So here's what we know in 2025. Mental health in America is in crisis. 47.8 million people are battling depression. Young people are struggling more than ever. Inequality is making it worse for vulnerable communities. Loneliness is epidemic, and our systems, while improving, still aren't meeting the need. But, and this is important, we're also talking about it more than ever. Stigma is decreasing, resources are expanding, research is advancing, people are getting help, and communities are coming together. This isn't going to be solved overnight. It's going to take policy changes, funding increases, cultural shifts, and individual actions. But every conversation we have, every person who seeks help, every barrier we break down, it matters. You watching this video right now, you're part of the solution. You're educating yourself, you're engaging with these issues, and I'm willing to bet you'll share this with someone who needs to hear it. And if you're struggling, please hear me when I say you are not alone, you are not broken, and there is hope. The darkness you're feeling right now isn't permanent. Help exists. Community exists. Recovery exists. We're going to get through this together. If this video helped you, hit that like button so more people can find it. Subscribe if you want more honest conversations about mental health, social issues, and the things that actually matter. And drop a comment below. I read every single one. Tell me your thoughts, share your story if you're comfortable, or just let me know you were here. And hey, if you want to support the channel and help us create more content like this, send a super thanks right below this video, join as a channel member for exclusive content and early access, drop a super chat during our live streams to get your questions answered. Every bit of support, whether it's a like, a comment, or a membership, helps us keep these important conversations going. I've put all the resources mentioned in this video in the description below. Crisis lines, therapy directories, screening tools, everything. Share them, save them, use them. Remember, your mental health matters, your story matters, and you matter. Take care of yourselves and each other. I'll see you in the next one.